The apical root canal system of teeth with post-treatment apical periodontitis, correlating microbiologic, tomographic, and histopathologic findings. This study was published in JOE 2020 by Jose Siqueira and his colleagues from Brazil. Their aim from conducting this study was to evaluate the microbiologic conditions of apical root canal system of teeth with persistent apical periodontitis, and later to correlate them with observation from CBCT and micro-CT imaging. The ABCs for this study were collected from patients who undergoes an apical surgery in a private practice. All patients were asymptomatic and at least presented with a persistent apical periodontitis for 1 year. The size of apical periodontitis was classified based on the CBCT. If it was equal or less than 5 mm, it will consider a small lesion. If it was more than 5 but less than 10 mm, it will consider as a large. And if it was more than 10 mm, it will be considered as very large. After sample collection, each ABIS has micro-CT imaging, and then they run a quantitative PCR to detect and quantify the bacteria. For the results, all 36 cases were positive for bacteria. Actinobacteria were detected in 35 cases, Streptococci were detected in 33, and E. faecalis in 7 cases. Actinobacteria were 2 times higher in granulomas compared to cysts. Streptococci were significantly lower by 70% in large lesions when compared to small ones. Also, they found an association between the total bacterial count, actinobacteria count, and streptococci counts with the volume of unfilled canal spaces. This has been found only when they have an adjusted analysis. However, this has not been confirmed with the adjusted analysis. 2 things I would like to highlight on in this study. The first thing is that they are not actually trying to find a causation between the apical periodontitis and a certain type of bacteria. However, they are trying to find an association between the disease and certain type of bacteria, because we know our disease is actually a biofilm-induced disease. The second thing, they only mention here the cases included, they are asymptomatic and have at least 1 year follow-up. For me, I would like to have more details about these cases. What are the teeth? How is the treatment has been done? I think these information are worthy to be mentioned.